Hello, everybody. I'm here again today with Nicole Bijlsma, and we're doing the second part of the series, How Do You Remove Mould and Prevent It from Returning? We discussed in our last part, how do we identify mould-related illnesses? So moving on from there, Nicole, how do you remove mould from a damaged building and prevent it from returning? What's a good standard mould removal process?
All right, so mould remediation is based on two key information. Firstly, the porosity of the material. Is it non-porous, like metal, glass, windows, for example, plastic? Is it semi-porous, like, for example, timber, other things like that? Or is it actually porous, like books and plasterboard and other things like that? So how porous it is the first bit of information a remediator will need to know. The second information is its condition. And by condition, I'm referring to the IICSC standard, which is condition 1, 2, or 3. Condition 1 means normal fungal ecology. Normal fungal ecology in a healthy home would be up to 500 spores per centimetre squared. So it's actually quite a lot. Most people think mould's the problem. Mould is not the problem because it's on every surface from the Arctic to the Antarctica. The key is in a healthy home, you have particular species of fungi that reflect the soil ecology from the outside. In an unhealthy home, in a water-damaged home, you have speciation. So you have high levels of fungal particulate typically found in a water-damaged home, Aspergillus, Penicillium, Cladosporium, Cutonium, even Stachybotrys. You don't want to see them in the home. The second condition 2 means high settled spores. That means when you do surface testing, surface sampling, that you're going to have potentially in the hundreds or the thousands of fungal particulate per centimetre squared. Condition 2 is difficult because you don't see the spores, so you don't see the visible mould. And the only way to establish that is with air testing. So if we do an air test in that bedroom and it comes up, in the hundreds or potentially in the thousands or tens of thousands of Aspergillus penicillium, we assume all the surfaces and all the contents in that room are condition 2 because we couldn't see visible mould, but we had high levels on an air sample. And we know often that there's been moisture-laden material. So anything that's got wet for more than 48 hours is a red flag. And that's all you have, unfortunately. Liquid water on a surface for 48 hours or more is going to start to have microbial growth. The problem with with humid environments like where you're at is that it's utilising the humidity in the air to grow. So when I was in Sydney last week doing air testing and surface sampling, I was using an ATP meter for my students to show that all the surface dust in Sydney and of course, Byron Bay and Queensland is growing, microbes are growing, bacteria and fungi are producing spores and hyphae and potentially chemicals in the air because it's utilizing the moisture from the high humidity to actually start infiltrating into that substrate and releasing enzymes and other gases which are incredibly toxic. In Melbourne, Adelaide, Perth, you've got the same level of dust, the same type of dust, but it's not growing because there's not enough moisture in the air. It's too dry. So this is the problem.
It's all about humidity.
It's all about humidity. So there is a cost to living in a humid environment like that, and that is that you assume everything's, and unfortunately, this is the way we've gone in the building biology industries, everything's contaminated in these environments unless there's evidence to the contrary. And unfortunately, that's very rare. I can't remember the last time it was not present in these environments. So you have to have potentially whole house dehumidification during most of the year in order to reduce the chances of microbial growth on those surfaces. Otherwise, you're going to have problems.
Except for those drier months. And we were talking last time about symptoms. And so if symptoms improve in the drier months, would that be another diagnostic as well of potential mould? Or once you've sort of got these spores in the house, it doesn't even matter if it's the drier months, you'll still be getting affected by them.
So sorry, the dog's gone off. Can you pause that for a tick? I'm just going to shut the windows.
Hello, everybody. I'm back again with Nicole Bijlsma, and we're discussing mould and mould-related illnesses. And this is part 2. The last part we looked at how do you identify mold-related illnesses, but this one we're going to look at how do you know if you do have mold in your house and how do you remove it and prevent it from returning. So Nicole, when would you use a building biologist to assess your home and why?
So the first thing is you're sick and no one's able to help you. That would be the most common reason. You've gone from practitioner to practitioner and your GP, etc., and you're not getting any results. Secondly, you have persistent, recurrent respiratory tract infections, recurrent colds and flus, asthma, allergies that are ongoing and keep coming back, and they're persistent and they're not responsive to treatment. Thirdly, you've had either a water event or you know that there's a drainage or plumbing issue, etc., and or it's since you've moved into the house. So they're the three keys. And of course, if you're away from the home, your symptoms improve. So you start to see that your house is making you sick and you're much better when you're on holidays or in other people's homes, etc. They're the key.
And what would a building biologist likely find if they were to come to your house and find that there was mold there that was affecting your health?
So the first thing a building biologist will do is take a comprehensive environmental exposure history to determine where there's at-risk areas of the home that could have high levels of moisture-laden material based on, history, plumbing, roofing, all that sort of stuff, drainage issues, etc. They'll also take a thorough history for health, not because we don't diagnose diseases, but we're looking for asthma, allergies, persistent respiratory tract infections, and chronic fatigue-like symptoms and autoimmune. They're the main ones that we'll generally find strongly correlated to water-damaged buildings. They'll then do a exterior and interior site inspection, looking for signs of moisture, how moisture could get into the building, where there are weak points. We'll do moisture mapping to see if there's moisture-laden materials. As soon as you have moisture on a surface for more than 48 hours, it's going to support growth, because in a healthy home, you're going to have up to 500 spores per centimetre squared, but those spores will reflect what's in the soil ecology. In a water-damaged home, you're going to find spores that are going to be more reflective of a water-damaged building, which is Aspergillus, Penicillium, Teutomium, Cladosporium, and of course, in some cases, Stachybotrys. So they'll moisture map, they'll use thermal imaging camera, they'll do sampling, air and surface sampling. Very important that they do sampling. I find a lot of clients, they get people coming in who've had no formal qualifications. They will then charge very little for testing, which is a big red flag that they haven't done their job. They'll then pay charge the client lots in fogging or remediation. You cannot remediate without testing. So you're best to put the money in testing to see how far that fungal particulate spread, A, if it is a problem, and B, how far that problem is in the home, because 100% of the time that we've gone into homes that have had previous people test, they've not done any testing or a little bit of testing. They haven't established a scope of works. They've charged $3,000 or so for fogging. And it's, if anything, it's actually exacerbated the problem because it's introduced more moisture in the air and the clients are still sick. So you might as well have donated that money to that company who had no idea what they were doing.
And so the standard, the gold star mold removal process isn't fogging, which is that ozone? Because I know some are using ozone as well.
Ozone, definitely not. In fact, the US EPA have actually said ozone is very dangerous to human health. And of course it is, because you're talking upper and lower respiratory tract infections. You're talking it damages the building materials, of course, and it doesn't have enough contact time. So it's shown to not even work effectively in water damaged buildings. Any form of biocide should not be used in water damaged environments unless there's bacterial contamination. If the source came from what we call Cat 2 or 3, which is sewage contamination, grey water contamination, etc., then you're going to use chemicals. But generally for water damaged buildings, you don't use any chemicals because 75% of the spores are already dead. So you're trying to kill dead spores, which is a waste. Secondly, if you inhale dead spores, you get sick. So the focus of remediation must always be on physical removal of the fungal particulate. And the first thing is to get to the source of moisture. If you don't remove moisture-laden material and the base plates are still wet, the gyprock's still wet, and you haven't checked it with a moisture meter, it's going to continually spew out this fungal particulate that's going to make the occupants continue to be sick. And that's why a lot of mold remediation isn't effective because they've never had any formal training in testing. In fact, the IC, even if they're IC mold remediators, the IC specifically do not cover testing. So unless they've done my course, ACES certified, which is the only government accredited mold testing course in Australia, then they're actually not qualified to test. And therefore, how can you do remediation if you haven't tested and developed a scope of works?
And so really you do just need to remove the source of moisture.
Absolutely. First and foremost, remove the source of moisture, establish the boundary of fungal particulate, and that can only be done with moisture mapping, thermal imaging, and then testing surfaces and air. Only once you've established where that fungal particulate is, where those water damaged molds are, then you can potentially set up containment, air scrubbers, all those other issues, and then you physically remove. So the mold remediator does what we call a HEPA sandwich. They get a vacuum cleaner, specifically horsehair, etc., and they vacuum the surface, followed by a damp microfiber cloth, followed by vacuuming. That's called a HEPA sandwich, and that's the way they deal with semi-porous and non-porous surfaces.
Nicole, thank you. Our next part of the talk is how do you care for yourself if you can't move out of one of these water damaged buildings and you can't get to the source of the moisture. So stay with me, everybody, for the next part of this talk.